Marty finally figured it out. Laura May, you would, I'm sure, know how to do this with your young, fiery self. She's amazing. You follow her, Laura May?
I'm doing
She is a spitfire. I love her
Laura,
content. She
hi.
comes on with some really good motivational type stuff. No
Oh,
excuses. Don't feel bad for yourself type
amen.
content.
That's the only way to get anywhere.
Yeah, and you guys can hear me too, right? Can you hear Karen? Can you hear me? You guys, we were supposed to join at 2 o'clock. Sorry for anybody that was already registered for it, but we're here to prioritize our health. Obviously, they got behind on things today, and so we weren't done when we thought we would be. But again, we just jumped on to at least say hi really quick. Karen's got to run, and I've got to get to the airport. I'm actually flying out tonight. But we did want to just jump on and say hi. We're here again at the rooftop of Bio Advance. Karen has some bullet holes in her face from treatment today.
Yeah.
Got some things going on in her neck for
Yeah,
her
thyroid.
So tell us, Karen, how was your trip? It was a quick trip for you.
This is probably the quickest trip I've had. It was 48 hours. I ran into some followers from TikTok. I was surprised to see, and they were surprised to see us. And it was it was a good one. It was wonderful. My son was declared in remission from a genetic eye disease that has plagued my family for generations that has no cure. And this is the first report in the history of the world, actually. So that's exciting. And
Well, and you can actually see it. I was with Jason, her husband, at dinner, and you can see, yeah, come say hi, Jason. He's the reason I'm here as well. But you can actually see in the photos the difference between their son's last visit and this time, where the retina, I believe, right, was detaching previously,
Yep.
and now. So the proof is in the pudding, right? Can't argue with these scans that were not even done here, right? So they were done by a third party and then provided to the clinic. So it's pretty incredible to see the results of some of that stuff.
Nerve reattached, and the retina has completely healed and reattached, which has never been done before.
Stem cells are wild. So Karen, I want to go ahead and throw a little bit of your business out there if you don't mind. I'm going to break some HIPAA laws here. You actually came here again, just like myself, preventative. Well, I'm still in my healing journey, right? I've never had the scan with no Lyme or Bartonella in it yet. Yet, exactly right. But this was in between scheduled visit for me anyways. I just am, again, I want more of everything. And so my real 6 month follow-up is in February, which I'm already scheduled to come back for. This was in between. Again, Marty wanted a premium oil change again because it made me feel so good the first time. Karen was scheduled again because this is part of your overall health and preventative maintenance protocol, if you will. All the other things that you do, this is one of those. And you actually got some disappointing news this time.
So we had been remediating mold in our home for the last month. I had shown signs of fatigue, flu symptoms that would come and go, and I just didn't feel quite right. So I've been in remission, actually Lyme free, for 7 years, and I knew something wasn't quite right. So I got my finger pricked yesterday, and we found a Borrelia intracellular just hanging out. So not only we're going to come home to a mold-free home, but now I'm detoxing. And they think that because of my thyroid condition, thyroid is linked to the mold. So we injected the thyroid, which has been known to resolve itself in one round of injections. I'm detoxing now for 90 days once I go home with their protocol, and I'm going to kick Borrelia's ass.
Again. Well, and I think that's good because, Karen, you were obviously upset last night. That's big news for anybody to get, especially from somebody who's so vocal and such an advocate for this. And I'm just going to again throw Karen out there and say, she said, I don't know what to say to people. I almost feel bad because she has, again, talked so much about this treatment and how it's helped her. But it's like, there are going to be setbacks like that. And I think you always have to prepare yourself for those things. And I just want to go back to something that you said before. And the fact that this is part of your preventative care and that you continue to come here for years and years and years, you were able to catch that very quickly.
Right.
And we all think, I know there's people on here. I know, what do we got on here? But I know there are mold folks on here from our little chronic illness community that will be absolutely, they're very intertwined. And so it's highly likely that that is exactly what is happening here. So that's unfortunate.
But what was cool was we saw one Borrelia, and when I came in 2017, it was a circuit in my blood. So he said, you came at the right time. We know what to do. Let's go.
It couldn't have been better timing again. Yeah. So I love your attitude about it, and you'll be back probably in 3 to 6 months for another scan.
We'll keep an eye on it.
Cool. What questions do you guys have? Please don't feel bad. It's true though, and I'll say the same thing, you guys. Even when I started to have a little bit of feeling in my hands a couple weeks ago, I just got them all shot up with stem cells. Cody is one person that, again, he's like put it all on the line almost to come here. And I will say again, from the actual clinic is where we're sitting right now. No one is paying us to do this, you guys. This is truly something that we're passionate about sharing. But there is a sense of I don't even know what. I don't know, just I feel you're all on your own journeys. We are just sharing our story here. Why I'm not being compensated for anybody that comes to visit here. And I definitely want people to make their own choices. And I certainly don't want to carry any guilt around for anybody that comes here and doesn't see the results because it's hard. You don't know if you're going back to an environment that has mold in it.
Exactly. And I didn't know that I had been living in mold for 8 years. I had no idea. I knew definitively probably the last 3 months.
What
Sometimes you don't know.
Thank you for sharing. It helps me out. Oh, absolutely. I have some good posts coming for you guys on, of course, your bougie boy Marty always wants a stem cell facial. So I got that yesterday. I actually got some good video of the room. She wouldn't let me film this procedure because, again, I don't fucking work here. But I did manage to sneak some stuff when she walked out of the room and had my little mask on. And then I did some pre-filming beforehand. So I did get that. And then this morning in the IV room, obviously you're allowed to film in there. So I got some coverage on that for you guys. And then the girls down there, I love them, my VIP IV girls. They did a little intro for everybody too. So I am going to the airport tonight, but I'll do some editing and posting for those of you that are interested in coming to Mexico for stem cell therapy for any of your ailments or conditions. We'll have a little bit more content for you.
Yeah. And as far as who do you find to figure out if you have mold in your house? You have more suggestions than I do. I could see it, so I knew where it was.
Yeah.
Most people don't know where it's coming from.
Well, there's a lot of ways to do that. There's an ERMI test that I've heard of. I think I'm saying that right, where you actually go around your house and collect dust. I still need to do that myself. It's fairly cheap. There will definitely be somebody in this chat that can answer that question. And if not, DM me and I'll send you to the right person that can
And
answer
there's
that.
mold sniffing dogs.
There are. Well, one of our followers just had mold sniffing dogs at her house. I think it might have been, I don't want to misspeak there, it might be Chronically Healing Indeed, or somebody that I talk to on a regular basis just had the mold dogs at their house this week. She did a post on it, and they'll have a full report in a week. But which I was like, I would have want that shit right away. There's the mold.
Yeah, where is it?
But the dog did hit on some things. So yes, there's definitely some ways that you can do that. I'm still convinced there's some mold in my house. I'm just, I left the carpet up in my room one night and I'm loony, I guess. But so there's a lot of ways you can do it. We already have an answer. ERMI. ERMI is a good place to start, but a qualified EP is always the, hired somebody to come to my house. And she also went through every inch of my house and did stuff, but she wasn't testing the air or anything. And then she sent me a report that was like a visual inspection. And it's like, well, it's not behind the drywall. So I don't know. I've seen a lot of crazy stuff. When I first was figuring out on this journey to find out what was still wrong with me, I asked some of you, I don't even know who it was, but I was like, why is it that everybody that has Lyme disease also has mold toxicity? It was like to me, I thought you all were weird. And now I'm one of you.
It's everywhere. And honestly, Dr. Alex said that if I had been exposed to this level of mold 10 or 15 years ago when I was in stage 4, it can honestly kill somebody. I couldn't have taken it. My nervous system, it would have been a bad story. So a testament that I've been living in it for 8 years. My immune system has been doing its job. And yes, I have some repercussions, but I'm traveling, I'm getting up, I'm showering, I'm eating, I'm not bedridden. And that is a testament to regenerative medicine and the stem cell therapy over the last 8 years for me,
100%.
and how well I've done and how I've taken care of my vessel when I go home. This isn't just a one and done here. I go home and take care of this in between my visits.
Oh, we know. But you've had some funky stuff going on lately. You've had
Yeah.
some ups and downs. You've had obviously some thyroid issues. And so, again, you were coming here to treat those things in your preventative manner and found what the root cause, essentially. Yeah, baby. Take a couple shots to the neck. Someone said, hey, guys, just talked to the clinic today. Waiting for my appointment now. Thank you for sharing. That's amazing.
Thank
and I hope that you literally do the same thing. And this is one thing that, again, if you are somebody that follows me or Karen or talks to either one of us, you will know that I almost force everyone to post about their visit here. And again, they will tell you the same thing. They're not being compensated for it. The reason that I post is because I found this angel right here who truly changed my life by putting her life out there and sharing this. And I felt so obligated to do the same thing. I know what hell I lived for 5 years, 5 to 6 years, and where I was in a very dark place. I was in a place where I thought the world would be better off without me, if you know what I mean. And I am certainly not in that place today. And I'm not on any medications. I do not go to the pharmacia anymore. Well, I go to the one here, not in the US. I don't go where they sell us all the poison at Albertsons to pick up more poison to pump into me while I'm waiting. That is what I don't do anymore. So I'm on no prescription meds, and I was on mental health meds for years and years and
I
years
was too.
because of this. And so were most people on here. It's kind of the go-to. You have anxiety or you have
You're
this.
not crazy. Something's not right.
You're definitely not crazy. Same. No, Laura, we know Laura.
When they do the chelation, so part of what they do here is detox. So even the last 48 hours, we are detoxing the mycotoxins. There's ozone sauna, there's different ways that they do that. And in the chelation, they can add all sorts of wonderful things based on your results,
That's right.
based on your body.
Mitochondria boosters is another one that I did and you do, and you
Yep.
were telling me, especially for women or we're gay, fabulous gays, it is like a skincare thing too. It actually helps heal your body and heal your skin from the inside out. I was doing a little bit of research on it today to learn more about it, and that's the thing. Like I don't jump on here and pretend to be the expert. I'm like literally learning this stuff along the way and just putting it together and trying to share it with everybody. The other thing that was new to me this time when I came was, and I don't believe it was in my last treatment plan, was exosomes, and asked about those today. Again, I'm just like yellow, throw it in. It was basically two different kinds of stem cells that they did, and I think the exosomes are a type of stem cell that go in. I'm gonna again do some more research on that, but I was like, give it to me, you know.
If you're not acutely ill, I've used them when I was in stage 4 for acute illness, but now that, well, and I'm obviously dealing with things now, but I tell people when you get that IV, my girlfriend's here, there's nothing wrong with her. She got all the same treatments, and what she's able to do is that's like skincare, longevity, rejuvenation from the inside out. Women are slapping this stuff all over their face in their skincare and paying thousands of dollars for creams. And we're doing it on a cellular level from the inside, and it does reflect in the skin.
Look at us. Lighting. It's all good lighting. The gays know how to light some shit. You know what I mean? We will find it. And if not, we have another little light here that we can use to give us a little juice. It's not working. Anyways, what questions do you guys have? So
From chelation. And so if your diastasis symptoms are rough from chelation, lingers, are you using coffee enemas? Are you getting into a sauna? Are you sweating, pooping? It has to get out.
yep. Bert Bear Holistic, I believe, is his. I always butcher his handle, but it's Jared. I know him. If you're not following him, do. He has a whole pamphlet you can get online. He really has dedicated his life to this and helped his wife recover from horrible illnesses that they found out were mold. And so he has a whole detox protocol. I actually I scheduled a session with him, which was very informative. He's the one who really taught me about your whole lymph system and how it drains on different sides. And then when I got home from my last therapy, you know, we'll see if it happens again. I was completely broken out along one whole side of my body, my face and everything.
One side.
And it was all of that neuroinflammation. And that was the biggest thing for me was neuroinflammation. As you guys know, if you follow me, my vision was impacted from it really badly. There is no way that I would be able to read this screen 3 months ago before I went to treatment the first time. Like, it just didn't happen. So I'm sitting here with no glasses. I don't have contacts or anything. And it was literally from stem cells. So it's wild. And well, and all of the other things, getting rid of the inflammation in you. So anyways, he taught me about the lymph system and how to drain that and doing all the, you know, massages. And it's crazy that crunchiness in your neck, if you've ever had that with Lyme disease, it's a hallmark symptom of Lyme disease. And it is a buildup of lymph fluid in your neck.
You can hear it.
And the fascia gets so tight there. That's what that crunchiness is. I almost let a neurosurgeon do surgery on my neck over it. Imagine that.
If it's misbehaving, let's cut it out and burn it out.
It literally could have paralyzed me. And so they found fluid in my spine. And they again sent me to what's the good hospital? Shit.
The good one.
No, I'm saying it's like it's in Phoenix. Where
I don't know.
it's like Grand Hospital that everybody's like, oh yes. I went to Mayo Clinic.
Wow.
I went to see a neurosurgeon at the Mayo Clinic, and they were going to operate on me.
Karen says no.
Yeah, I said no because they literally told me like there's a potential that you could not walk after this, and I was like, do we know that the fluid is what's causing this? So, anyways, crazy stuff. You guys are all right. Mayo.
Yeah.
Hi, Lizzie. Hey, I used my Amex at the hotel. Just so you know. We'll see what happens. That's what they told me. Exactly. You guys got to go. We can jump off. We just wanted to. Jason, let us know. He's the manager's over here saying my talent's got to leave. No. Anyway, so I don't know if you guys weren't on here before. It was pretty cool during this trip. We ran into a couple people that were here because of us. So it was like little mini celebrities. They were like really coming up to us. There was a lady in the hotel. I have a 3-minute video that I'm going to post. Her name was Ali, I think. I'm really horrible with names. Sorry, but I do know her name. I'd never even communicated with her before. She hasn't even DM'd me back and forth or anything. and she saw that I was posting from Lucerna, and she
Mhm.
literally messaged me. You guys can see it in my comments, and said, "I'd love to meet you at the pool. I'm literally here because of you." And
Mhm.
so I went down and talked to her. She was a teacher. She teaches in Japan, and she doesn't even have Lyme disease. She came here for regenerative stuff and was already feeling better before she left on Wednesday. So
Mhm.
really incredible. And that's the kind of stuff that, like, it truly fuels my soul to hear that and meet people like that with that are making a difference. So if you do come here, just like Litzy, I made her post. Wild Woman's going to post. We got to make
Mhm.
everybody share their own story because it will change somebody's life. And I can tell you, the other thing that's when you're in your own healing journey and getting through this, like, really lifts your soul,
Yeah.
which is important. And
And you
we
don't
need
feel
that.
alone anymore.
That's
Yeah.
right. And when you can connect with somebody else on that whole journey and, like, see the difference that you helped make in their life, I can assure you it's also making a difference in your life. So it's like a multi-level marketing scheme. And no, we're not getting paid. But it's like the whole whatever it is. So you get what
It
you get.
pays
Yeah.
forward
That's right.
in ways that you could never imagine, and then you meet one person and you realize, wow, all the trolls, all the bullies, all the BS, it doesn't even matter
It doesn't.
because one person found their next step.
Well, there was somebody in there. Somebody was coming to my defense last night in my comments because somebody was like, "I feel bad for you," and I was like, "You can feel bad for me all you want. I know how I felt when I left here, and I know how I feel. You're getting scammed. Well, it's my money. If I want to get scammed, I will."
Yeah.
Some comments in this live were,
Oh, they're
oh,
protecting the community
oh, so
experience.
they're already there.
Yes.
So we have some haters in the comments. I'll find out what they were later, y'all. Probably one of those little trolls on here right now.
They can't help themselves.
Oh my God. Oh, you died? Oh, well, you can't repeat it. I wish you could DM me and let me know what it was. Lucerna is the hotel. But also, Karen and some folks stay at Fairfield. They're both great and right
Yeah.
close to the.
It's all within a block.
There's three that they recommend on the website. The K Towers, which is
My
bougie.
favorite.
That's bougie. I haven't even stepped up to that
That's
level
my
yet.
favorite.
But maybe next time. The Lucerna, which is my fave, I love it, and then the Fairfield. So they're all within walking distance. And I think I don't know if the Fairfield does, but I know Lucerna, they'll even shuttle you back.
If you're in a wheelchair, if you need a shuttle, they're not gonna race cross streets. They've got you.
When you talk about how you felt after the first treatments, did you feel any benefits? Yeah, you can actually go back if you haven't watched mine. I have a playlist on my page called Lyme Treatment in Mexico. There's like 40 parts to it. I literally was posting live while I was here last time. So you can see, and I post, there's also another playlist called Lyme Recovery, where once I got home, I was posting every week and updating you guys on how I felt. It's been 3 months-ish since my first round. And again, I am such a go-getter in life. I obviously felt so good with the first treatments. I wanted more of that. I wanted to make sure I was doing everything I could to continue to feel this great because for 6 years of my life, I already did all the work to feel better. I went to any treatment, I took any pill, which I never wanted to do, but I was willing to do whatever it took. And I never stopped searching. And a lot of you will say that. I knew deep down something was wrong with me, and it wasn't the things that they were telling me. I knew at 42 years old I didn't just become bipolar.
Yeah.
I knew that.
And
Now I'm still a little crazy, but
that's exciting. But someone just said doctors are pushing stem cells in the U.S. and they're cheaper. They are not the same caliber. No. They are not accessible in the U.S.
Nope, you can't even get them.
They're not in the U.S. And there are reasons for that, which I will not go into.
Well, you can say it. I'll say it. Basically, if it's FDA approved, it's not good for you, right? They're not preventative. They want to heal you, or they don't want to heal anything. They want you on long-term something. So not a lot of the things, you guys, that's why they're coming after peptides as well. Those are all preventative medications that keep you from getting sick. And so
that you can opt out of the system.
I love getting in trouble. Where is the website to get prices and length of time? You get about $3,000 to $5,000 for your visit, they say, for most folks. And it's really personalized based off of what you have going on with you. And I will also say this, one of the most refreshing things the first time that I came here was we sit you down before that. So you're committed to basically $200 once you came here. And that's, I think, what your consultation fee is.
And the finger prick.
And then once you sit down and have that test, they are going to tell you, here's all of the treatments available to you. Here's the optional stuff. Here's the stuff that we recommend. But you have that bill in front of you before you go into anything, which is clearly not like the US. And it's fairly reasonable. I know it's also expensive, but testing is expensive. And as we all know, continuing down that path of chronic illness in the U.S. is very expensive. I spent $8,000 to get tested for Lyme disease in the U.S. And the clinic that I was going to go to in Scottsdale wanted $71,000 to treat me. I came here my first week and it was $6,000. And it was absolutely worth it. And again, Marty Mar got all the bells and whistles. You don't need a stem cell facial when you come here, but I do recommend it.
If you just Google Dr. Calzada at Bio Advanced Medical in Tijuana, it'll pop right up.
Yep.
And I recommend that people fill out the new patient form on that site. It doesn't cost anything to do that. Then you're registered as a patient, and then you can even make an appointment. There's no deposit required. And if you decide you don't want to keep that appointment, you just cancel it. No one's taking money from you before you even get here.
Probably it sounds quite trivial, but I don't know how to. You can pay with a credit
You
card.
can.
You get those miles, baby. I don't know.
So when you're in process, they're going to prick your finger every single time. And that is how they're going to measure immediately success from one visit to the next. So they were able to see when they pricked my finger last time, that blood analysis had changed from last time, and he could tell I was struggling with something. And then we explained mold, et cetera, and we started to put the pieces together. So they can see from one finger prick to the next, going forward or backward, and that's when treatment changed. I did treatment this time in a different way because my thyroid was involved, et cetera. So it's backward, and that's when treatment changed. I did treatment this time in a different way because my thyroid was involved, et cetera. So it's based.
Touched me. My daughter will. Jason's running to the pharmacy. He'll be back soon.
Okay. See you soon.
Love you. Scream. Like and share, Jason. See. How often are other trips down there? I mean, it's again up to you. Yeah.
So they see mold mycotoxin issue in live blood. They can see the effects of mold and mycotoxins, but mycotoxins are so small they defy the live blood analysis.
Yeah.
It's not, they cannot see that. They can the effects and what it's doing to the body and the cells.
But in that case, you can go. I had a mold toxicity test, my mycotoxins, right? So you can go to pharmacy.com, FRMACY, like pharmacy, but with an F. And I think I don't know how much it's on there, pharmacy.com, get a my mycotoxins test. I had one done at the clinic that I went to Vita, and that's how I knew I had mold toxicity. And it tests for, all of them.
Mm-hmm.
So if you want to do that first, you certainly can. You can measure the that, or again, get additional testing. But, I don't even know. I've thought about this too. It's like, at what point would I want to spend the $1,500 to get another Lyme tick-borne illness 2.0 test? To me, that doesn't make a lot of sense when we can do the dark field microscopy.
Right, because they're spirochetes. There's over 200 different strains of spirochetes. So it doesn't matter what strain it is necessarily. The spirochetes are there or they're not. So for me personally, I'm not going to spend an extra several $100s to figure out what exactly it is. They're there or they're not. We're dealing with it.
Yeah, so Litzy here said, and if you're not following her, follow her. She's not really, a poster, but she's been doing some stuff, but maybe she'll DM you. But she says her integrative health is very impressed with what I had done at Bio.
Yeah,
that's
yeah.
amazing. Obviously.
And
We're with a doctor.
he came with us.
Yeah, he is a doctor from the U.S. and is coming here for treatment, and he suffered from long COVID and was truly getting the same kind of thing from his own colleagues in the field in the U.S., which was he is very interesting to talk to.
And he was skeptical too. And he went to Greece and dropped about 70 grand on treatment there, failed him. And that ended up being his first treatment round here. He was very skeptical. He's amazing. And he's here now on his second round, drastically improved.
Leanne, I'm sorry to hear that. Told me to see her. I don't know what your specifics are, but that sucks. That's the DM. My mycotoxins has free radical cell damage. I have a ton of it dealing with mold and Lyme right now. Yeah. Oh no. Yeah. Did you go home to mold? Was that you? I was just saying to somebody that they went home and because I have. Oh.
To be the unpaid self. So as far as cancer, Dr. Calvada runs something called killer cells. It's a protocol for cancer. It's quite a bit more expensive than what we've done success here treating the big C.
Yeah, I mean, I'm not a doctor, so I don't know on this one. My daughter has Lyme, mold, and a brain injury. So yeah, that would definitely be something you'd want to spend $100,000. Yeah,
hope is everything.
Well, I think I mean, basically, Evo treatment is a form of ozone therapy, right? I think is where they run it through and do ozone and then like ultraviolet.
The light.
Yeah, the light. That specific one here, but I've seen that done.
I've
in
actually
the States.
had.
Right?
Yep, I did it.
I mean, I would opt. I mean, again, do you?
I just needed a more comprehensive approach. I couldn't just pick and choose ozone or hyperbarics, or I needed the whole enchilada that was here. That's what my body responded to after fighting for 25 years.
Yes, definitely lupus. Absolutely. They got that in the orientation. They say most of those things, lupus, MS, a lot of those. I mean, the people who came here with an MS diagnosis and then found out and went through that protocol. Well, thank you. Come on, don't be a hater. A clinic in California does e-pop. Like, go F yourself.
Yeah.
Yeah, yeah.
So ozone, they do intranasal, rectal, they do,
What
yeah.
does that do for you? Wow.
They can go into any,
Oh,
they can get you anywhere with those.
she just had shots in her face.
And right in here, yeah.
Rachel being twice a week. She gets lymphatic massages and ozone. I mean, girl, I did find an ozone place in Tempe. I'm gonna go see one of this chicks. I believe she came or is coming to us, and she owns a clinic. She's already a Lyme, recovering from it. She obviously has it again, but she has a clinic in Tempe that does ozone and the coffee colonics or whatever we
coffee
call it.
enemas are queen, people.
Yeah.
You want to detox? There's nothing can do your research. It's their reason.
I can't even fathom doing that myself. I mean, you know what a spaz I am. Like, I need to go somewhere. And
It's amazing.
as weird as that is, I actually thought when I had it done here, like it would be more like a self-serve.
colonic.
Yeah, like a machine type situation. No, it's a team sport for sure here. They break out the buzzer and start like rattling your guts to get it out, and she's just shaking you. I'm like, oh my God. And she just rolled you right over and just whoop, there it went.
Yep.
Yeah.
I'll stay with Calzada. There's discounts here if they know your patients. Fairfield's like 125. Lucerna's
It's $200 a night.
Yeah. Just depends on where you want to stay.
And I will tell you with Lucerna, if you click on the link on the website, it says there's no dates of it. That's not the case. Just go to Lucerna website, make sure you're on Lucerna, like literally check your URL. This thing, they will cookie you and it'll be like some third party thing. If you go right to Lucerna and book it, it's $200 a night for the bougie rooms. I was in a junior suite. My bill for $100. Yeah. Evaluation waiting to hear back. Good for you.
So when you're waiting to be back, make sure you check spam and trash folder. I know many times their reply will end up there.
Oh.
And if it is not in there in a week or two, being a squeaky wheel and calling.
Okay.
That's what I call.
I didn't have to. I don't know why.
You got right in.
I had just the angels were on my side. I'm telling you, that somebody knew I was gonna do this. I don't know. I just got back from Bio Advanced. I was bit 10 years ago, and they found in 22 minutes exactly.
It's that fast.
And how do you feel, Ariel?
Ariel.
Yeah. How's it going for you? Dr. Ben said no.
Yes, no ibuprofen and no peptides that are anti-inflammatory like the Wolverine stuff. We wait 1 week before we can even touch those.
I'm really glad you told anybody else on peptides as well, and it totally makes sense, right? Like you want the stem cells, the IV stem cells that they're giving you. That obviously the pinpoint going, it really need to be, but
they find the inflammation.
Yeah, but
do their work.
so if you're taking another
anti-inflammatory
to reduce inflammation, which is what they do, then you're not getting your bang for your buck. Yeah.
So I'm only here for 48 hours this time, but when you're a new patient around.
I was there for treatment 2 months after contacting them, yeah. By myself, my mom is serious, and she...
So staying in San Diego, most people, when they're afraid, they'll stay in San Diego and take the shuttle. When you are not well and you are tired, you will find out right away that, first of all, you're safe enough to stay here, and it is a pain in the butt to go back and forth. You're exhausted. And most people regret staying in San Diego because it adds another hour on each way to your day. You can walk to the clinic from the Lucerna, the K Tower, the Fairfield, like a half a block.
I just posted yesterday the treacherous, I called it, walk. So I sped it up and showed you guys literally like what you walk through, what it's like. The woman that I met at the hotel, again, that meeting for the first time, I asked her, and I'll post this video later, going alone, right? And
I traveled alone.
I mean, my ass travels alone.
I came 2
it's fine.
times
It's
by
just walking down
myself.
the street. They could get me too.
Yeah. Buy a bowl of fruit on your walk and say good morning to everybody, and they'll say good morning
Everyone
to you.
is so kind here. Seriously, you guys.
They're ready to help.
Yeah, you can certainly do that. You can go back, and it's going to be a really long line. So you can get a med pass every day to kind of beat the line, which is when you come to the clinic, they use Easy Cross across the street. And speaking of, they need to pick me up soon.
Okay.
Yeah, we should probably jump, guys. I actually have to get to the airport.
Late stage, it's not too late. I was stage 4. I was half alive, and they saved there is always hope. Late stage means nothing. Like, the game's not over, I promise.
My treatment was $6 grand the first time, and that was with a $500 facial and like every spa treatment that they offer. So 3 to 5K is a good estimate. Thank you guys. We loved it. Sorry we weren't here when we said we would be, but again, we had to focus on getting our shot. So this was really fun sitting down with me and doing it. We're getting rained on right now. I love you. Look at these. Look at
You
this.
guys, we didn't